All righty. Well, Jamie, I'm going to hand it over to you and let's go ahead and get started. I'll let people in as they come.
All right. Hi, my name is Jamie Sorensen, as Mark mentioned. Just want to give a couple seconds for you guys to read this disclaimer that this information is relevant as of today. As we know, COVID is a fluid situation, so subject to change. And this presentation is a partnership between the Labor Management Partnership at Kaiser Permanente, where I work. And part of my role there is to bring health information, insurance, and Kaiser information in particular to union members. I do a lot of partnership with LERC as well as with individual local unions in terms of training, education, and health insurance information. And I did speak over my slide. There's my information in the lower left-hand corner, right-hand corner, sorry. Should you want to get in touch with me and get more information or have presentations similar to this. And to MC our event is Jennifer Stacy. She is the Director of Strategic Accounts and Dental in Kaiser Permanente, Kaiser Foundation Health Plan of the Northwest. And with her is Dr. Antoniskis, and I'll turn it over to Jennifer for introductions.
Thank you, Jamie. Couple of just housekeeping events. We will be going through a series of questions that we get most frequently about COVID-19 with Dr. Antoniskis, but the chat's also available. So if you have questions for Dr. Antoniskis as we go through this, we will try to work them in and we'll have time at the end. It's my pleasure to introduce Dr. Antoniskis, who's originally from Nebraska. She graduated from the University of Nebraska and did her residency in the University of Nebraska Medical Center. She did an internal medicine residency and disease fellowship at Los Angeles County Hospital. And her training occurred in the early years of the HIV epidemic. So she's well positioned to work through this pandemic with us and brings a lot of knowledge to the stage. So thank you, Dr. Antoniskis, for joining us, and we'll move on to the agenda. So what we'll be covering today is a COVID-19 vaccine update. We'll talk about the details of the vaccine, including safety, how the variants, the confidence you can have in the vaccine. And then, as I mentioned, we will run through questions if you have them and entertain those as we go along, as well as having time at the end. So please can use your chat function and we will work with you on that. So the first question that I'll throw to Dr. Antoniskis is really, can you provide us the latest on the COVID-19 vaccine? I know the news changes day to day as we run through boosters and third shots and recommendations.
Right. Well, thanks, Jennifer. You're right. As of today, I'm going to be talking about today, but things are changing, and actually I expect a lot of changes in the next month or so. And we'll go over those as the talk goes on. And it has been a confusing ride with COVID. And in terms of where we're at with the vaccines, almost all the vaccines are what we call on emergency use authorization, which means they were evaluated and looked at and approved for use in an emergency situation. But the one vaccine that does have full FDA approval as of 2 months ago is the Pfizer vaccine for people that are 16 and older. And the brand name of that vaccine is Comirnaty. I believe it's kind of a play on community and has RNA in there because it's an RNA-based vaccine. But I expect that we'll be having more and more approvals over the next month or so. Right now, there is emergency use authorization for the Pfizer vaccine in adolescents, 12 to 15 years old, and I'm expecting that in the next month or two, that will be expanded to even a lower age range, probably 5 and above. Moderna right now is approved for 18 and above, but for emergency use, but I expect that they will be getting full FDA approval this month sometime. And then the Janssen or Johnson & Johnson vaccine, which is kind of an interchangeable name for that vaccine, will probably have full FDA approval by the end of this year. So they will have gone through all the steps necessary.
Excellent. Thank you. Yeah, it changes day to day. And I know that you mentioned the Comirnaty, the play on words, but that the Pfizer vaccine is exactly the same. That's just their brand name. Is that accurate?
Yes, it's the same thing that's been being used all along. They just, when something gets full FDA approval, then they get a brand name in addition to the generic name. And that's true for any kind of medication.
Thank you. Okay, so can we talk a little bit about third shots and boosters? Because they're different, but we hear them used in the same breath all the time.
Right. So first, let me say that it's, again, the same vaccine at the same dose in terms of what you get for a third shot and a booster. And really the difference is that a third shot is for people that are immune compromised, like they have a kidney transplant, or they're on chemotherapy, or they have HIV infection, something that gets in the way of their immune system being able to build a full vaccine response. And so they get 3 shots to complete a full vaccine series. So they should get 1 shot, either, first shot, and then either 3 or 4 weeks later, get a Pfizer or a Moderna shot. And then 28 days after their second shot, they get a third shot. And those 3 shots for those immune compromised people are considered the series. The difference with a booster is that, again, same vaccine, same dose, but it's given later on because people without immune compromise, they do build antibodies, but we know that over time those antibodies start to fall. And so right now for the Pfizer vaccine, the recommendation is for people 6 months after their second shot, they should get a booster shot. If they're over 65 or they have other illnesses such as obesity or diabetes, things like that, or if they work in a situation that makes them at higher risk for COVID, like healthcare workers or teachers, something like that. And right now, booster shots are only available for people that received Pfizer as their first vaccine doses. I expect by the end of the month, again, we'll see approval for Moderna boosters. Right now you can get a Moderna third shot, but you can't get a booster with Moderna. It's very confusing. But again, you can see who's recommended to get booster shots. And third shots are really for people that have some serious underlying immune problems. And if you have questions about that, be sure and put it in the chat, because I know it's very confusing.
Yeah, I guess what I think about is, like I have to get my tetanus booster because that wanes over time. And that's a true booster versus even the second shot of the series that I got for the COVID vaccine, which is just a series. So 3 shots in a series. And that kind of accurately describes it. Is that true?
And I expect as time goes on, as we see maybe more variants coming, or we learn more about the immune response, we'll probably see more boosters. It may be a yearly thing, it may be every other year thing. Again, we're still really learning about the ideal time to give boosters.
Right. Thank you. So I think this is a good time to really talk about how does the vaccine work? Because you mentioned mRNA, and that's, the basis of both the Moderna and Pfizer. And I think although it's been around, people aren't as familiar with it as some of the other types of vaccine, like the flu vaccine.
Right. So you might hear me say the word vaccine platform. That's kind of the basic way that a vaccine is built. So the Pfizer and Moderna COVID vaccines are on something called an mRNA platform, which, although it hasn't been used in widespread vaccination efforts like we're seeing now, that platform has been around since the 1990s, and it's been used for Zika and Ebola and even some HIV vaccine trials. And so it's not a totally new vaccine platform. And the way it works is that the Pfizer and Moderna, which are mRNA vaccines, there's some genetic material called an mRNA, which is made of it's the virus type of genetic material, and it's combined with some salts and some lipids and some, just some fluids, and it's injected into your body. It goes into your muscle. It tells your body to make this thing called a spike protein, which is that red spiky thing that you see on all the pictures, sticking out from the COVID virus on all the pictures. And it tells your body to make that little spike protein just for a short period of time so that your own antibodies can be directed against that protein. And it tells your body, hey, this is the protein that is also present in the virus and your body makes antibodies to it. And then the vaccine goes away. So it doesn't go into your DNA. It doesn't change anything in your cells. It's not gene therapy in any way. It doesn't have any live viruses in it. And it doesn't have any cells from fetuses, not in the vaccine. And there's no way that you can give off virus after you get the vaccine. The adenovirus vaccine, which is the J&J vaccine, they take a virus called an adenovirus, which causes kind of flu-like illnesses, and then that virus is killed. And then again, material, genetic signals from the virus are put inside this adenovirus. It tells your body to make, it gives your body's immune system the signal to make antibodies, and then that vaccine goes away. And it's really utilizing, one of the most natural things that we have, which is our immune system. You cannot get an infection from these viruses. Again, it's not what we call a live virus. It's not the whole virus. It can't make you sick. And so it's just a little bit of instruction to tell your immune system to make antibodies.
Thank you. I know I found that incredibly helpful when you first explained it to me, to really understand, like, well, what is the difference between the two, and then what happens once I receive it? Because, I've received vaccines all my life. I've never been so bombarded with information about it, and really started thinking through, like, what does this look like? So I think there's some real positive to people being focused on and understanding better what's happening, but then also really important that if you are going to focus on it, you have the level of understanding and good information. So thank you for that. And so I know really what is on a lot of people's mind, particularly as this has rolled out and we've been learning more and more, both about COVID-19 in general and these vaccines, is how do we know that this is safe and effective? So can you talk a bit about that?
Well, let me talk about the effective first. We know this is an amazingly effective vaccine that, it has over 90% efficacy in terms of preventing people from getting seriously ill or being hospitalized. Even with variants like the Delta variant, it's still very, very effective in terms of keeping people from becoming seriously ill. When you can look at this first bullet point, when you look at the data of the millions of vaccine doses that have been administered in Kaiser Permanente, you can see that less than 1% of fully vaccinated people have even gotten infected, and way less than 1%, 0.03% have required hospitalization. And that data is holding true through, in other places besides Kaiser Permanente. We're just seeing that all over the place, that people that are getting vaccinated have a 4.5 times, people that are unvaccinated have a 4.5 times greater chance of getting infected. They have a 10 times greater chance of being hospitalized and an 11 times greater chance of dying compared to people that are fully vaccinated. So we know that it's effective. In terms of how do we know that it's safe, there's a lot of concern about the speed at which this vaccine was developed. And again, I want to reiterate that it's not like this vaccine had to be made from ground zero, because we had the technology there. And that's what's really nice about these mRNA platforms, is they are very quickly adaptable to whatever kind of virus that you find. And so I expect that we're going to be seeing more and more vaccines on this mRNA platform as time goes on, because they're quick, they're adaptable, as opposed to a flu vaccine that takes a long time to develop, because you have to grow the virus in some eggs, and it's just a very long manufacturing process. But in terms of actually looking, even though the trials went quickly, they involved a lot of people. The studies that looked at both the Moderna and the Pfizer and the J&J vaccine involved over 30,000 people in each one of these studies. And just to put that in perspective, like when the hepatitis B vaccine was developed, that was developed with 20,000 people. So there were a lot of people that have been involved in these trials, and they went through all of the same process that slower vaccine approval goes through. That they looked at the safety and the efficacy, and it just moved quicker because we were in an epidemic situation. But they didn't cut any corners, they didn't not do any steps, and that's how it was developed quickly, because we put a lot of resources into doing that. It was reviewed by all the independent people that had no financial interest in the development of the vaccine. And really, these vaccines have really been some of the most scrutinized vaccines in history, because we've been monitoring them now for almost a year after being injected into millions and millions of people. And you can see on this slide that there are these two ways to monitor. One is VAERS, the Vaccine Adverse Event Reporting System, and one is vSafe, which is a cell phone based app that people get messages and can report symptoms in real time. VAERS has been monitoring all people, any kind of side effects get reported to VAERS, can be reported by the person that gets the vaccine, can be reported by their healthcare provider, their primary care doctor. Anyone can really report to VAERS, and those reports are investigated very, very thoroughly. The approval process for younger people, again, is very strategic and very thorough. They've actually slowed things down a little bit. Looking at the younger age group, they expanded, the FDA required an expanded number of study participants for the children's age group, because they really did want to make sure that it was safe. And so we're looking and following, and the CDC and the FDA are monitoring things at every turn. And so can I tell you that in 20 years, there's not going to be something? No, because none of us can see into the future like that. What I can say is that it's very unusual for any type of vaccine to cause a long-term side effect. Usually the vaccines, what you get in terms of side effects from vaccines happen quickly. And that's what we have seen. I mean, I'm sure you've heard of some, different kinds of serious side effects like blood clotting or inflammation around the heart. I mean, those things have been reported, but they're occurring at a very low rate. And those things can happen with COVID infection as well. And there are very few things that we're seeing with these vaccines that are over and above the risks that there are with anything. I mean, really, there are risks to anything you do in life, right?
Right. And my understanding is that the risk of COVID far outweighs what the side effects are. We have gotten a question in the chat, and there's a few questions embedded in it. So I'll start with a couple of them, and then I'll work them in as we go, because we're going to address a couple of them. And the first part of it is that the person had heard that other coronaviruses have been around for a long time, and is wondering, what makes this one so awful, and will we ever get rid of COVID-19?
Well, those are really good questions. And yes, coronaviruses have been around for probably thousands of years, maybe longer. You may have heard of some previous pretty serious ones. One is called SARS-1, which was, probably 10 or 15 years ago. And then there's MERS, Middle East Respiratory Syndrome, which is another kind of coronavirus. So we do have some experience with coronaviruses. Usually the biggest problem that, particularly what makes this particular coronavirus bad, is that there's not a lot of cross antibodies that happen. Sometimes when you get infected with one type of virus, something, and you build antibodies to it, and then you get another type of virus, there's what we call cross-reacting antibodies that can protect you from the second one. We don't really see that with COVID. And so we don't have, as a species, we don't have a lot of cross-reactive or previous kind of antibody experience, which was kind of what happened if you've heard about the 1918 flu. It was the same kind of thing. There really weren't any antibodies to that flu. And so that's why it killed so many people. And the second thing is that it just is so infectious. And so it spreads really well. And, at the beginning of the epidemic, it was one infected person, usually infected a couple others. Now with the variants that we've seen, which is, a normal process of viruses, they do mutate, they do make variants. The current Delta virus spread, like one infected person can infect 5 to 8 other people. So it's the infectiousness of it that makes this one particularly challenging.
Thank you. And we'll come to a couple of the other questions as we go. Let's move now, since we've been talking about the different vaccines, both the mRNA and the adenovirus one, so J&J. What should people choose, right? We don't have the supply problem we did at one point. And so what vaccine should they choose?
Well, I think it kind of depends on what kind of group you're in. And I think this is a conversation that really you should have with your medical provider, because, for example, young men less than 30 probably should get a Pfizer vaccine instead of a Moderna vaccine because of the heart inflammation issue. And a young woman that is in reproductive age maybe should get an mRNA vaccine instead of a J&J vaccine because of the blood clotting issue you've seen. For most people that aren't in some other, aren't in one of those groups, probably any of the vaccines are fine. And for most people, it doesn't really make a difference. And the ACIP, which is the Advisory Committee on Immunization Practices, they're a committee that advises the CDC. They don't really have a preference. They don't say that this person should get this and this person should get that, because we know they're all good vaccines and they're all good at keeping people out of the hospital or keeping people from dying. I do think we're going to need boosters for all of them, so I don't think there's necessarily going to be a preference for that. So again, I think if you have particular concerns, that's something I would discuss with your medical provider.
Yeah. And I think even that is just a product of being so fortunate to have 3 available so quickly, right? Because even the side effects you're talking about, possibly avoiding are so minute. They happen so little, but if you've got an option, right, why not take it? So maybe that's a good segue right now can you talk a little bit about the side effects?
Yeah, so the most common side effects are the ones listed in this on this slide, far and away, and most people actually don't have any side effects. But if you're going to have some, these are usually the ones that you have, which are, you may get a little bit of a fever, feel kind of tired, kind of achy, kind of fluish, and your arm hurts. That's the most common thing. But usually those only last a day or two. They go away with some Tylenol. And it's really what we expect, that, as your immune system is revving up, though, these are the kind of symptoms that you can have. So in some ways, it's a good sign that you get these side effects. On the other hand, if you don't have any side effects, it doesn't mean that your immune system isn't working. And that was my daughter's concerns, like, oh, I didn't have any side effects, so, like, does that mean the vaccine didn't take? That doesn't mean that. It just means that, some people have side effects and some people don't. In terms of the severe side effects, like Jennifer said, they're so rare. Again, this clotting issue that you may have heard of with the J&J vaccine, which causes you to have low, you see low platelets, which are the things that clot your blood, and some serious blood clotting issues. That's happened 47 cases out of almost 15 million vaccine doses. So I didn't do the math on that, but that's got to be way less than 1%.
Probably less than you see in a population that doesn't have the vaccine, I'm guessing.
Oh, I'm sure. And if you weigh the risks of these serious side effects, they're like 1 in a million, 2 in a million, things like that. Mm-hmm. And then you look at what's the chance of dying from COVID in this country. It's 1 in 500, really. I mean, 1 in 500 people have died of COVID in this country. And if you've got other underlying medical illnesses like obesity or diabetes, then your number is probably even higher than that. So, it's like anything in medicine, you have to weigh the risks versus the benefits, and your chance of getting COVID and dying of that is actually much higher than any of the severe side effects from the vaccines.
Yeah, thank you. I'm going to move to the next one, and I think it addresses one of the questions that the original person had put in the chat, which was talking about, will the vaccine work against the variant? And then asking as well are there other variants of interest that we should be worried about?
So let me just say a word about variants. So when viruses are growing, they grow like, they don't reproduce with just 1 or 2 other viruses. They make millions of viruses as they're reproducing in a body. And so it's just normal for different variants to emerge as there is uncontrolled infection, either in a population or in a person themselves. And so it's not unusual to see variants, and we will continue to see variants until we get a significant enough number of people vaccinated worldwide, really, because you know how people move back and forth, the virus is going to move with them. So until we really get to a herd immunity situation worldwide, we're going to keep seeing variants. The good news is that, right now, the variants that we have seen, the current vaccines are working very well against them. They're protecting against the Delta variant, which is almost all of the infection in the United States right now. But as we, until we get to the point where most people are vaccinated and we don't have a lot of viral turnover, we'll probably keep seeing variants. And again, that's one good thing about this mRNA platform, because it's pretty easy to tweak the vaccine and make it work against any new variants that might emerge. So, again, what people can do as an individual to prevent variants from emerging is to get vaccinated, because anything you can do to bring down the number of viruses out in the community is what you can do. Again, the other, I don't want to say vaccines are the only thing you can do. I mean, it's an important thing, but masking, good hand washing, avoiding going to places that have a lot of COVID, those are all good things that you can continue to do, and they'll help you with other illnesses as well as COVID, because, last year, essentially, we had almost zero flu in this country because there was so much masking and hand washing. And those are just good practices that we can continue to, and staying away from people that are sick, not going out, not going to work. If you're sick, that's also very important. So those kinds of things are things that you can do as an individual to kind of reduce the spread.
Yeah. And it's just so interesting. I mean, when I saw people with masks, 2.5 years ago or whatever, you looked at them and you thought, oh, I wonder, is everything okay? What's happening? And now it's just so normalized.
Right.
I'm hoping with most people, because I think it'll be a tool that remains with us for a while. There's a couple of other questions in the chat, and one of them is really thinking through why there are people in the community that are refusing to get the vaccine that may be in the medical community that you would expect perhaps to be more readily wanting to get it. Some of that would just be conjecture, but I think it's helpful maybe to talk about what we could say or how to speak to people who are hesitant to to get the vaccine. I think you gave some good advice there, talking about, not only the protection that it provides you, but how we have to reach that herd immunity to be able to, reduce transmission. We do still have people that cannot get a vaccine, including those that are younger right now. And so, perhaps a little thought around what you found to be effective when you're talking about, talking to someone that is vaccine hesitant. And before I stop talking though, there was a question that said some people are saying that the vaccine causes the body to create a poison in the body. And I don't know that I've heard that one, and I don't know if you've heard anything like that.
Yeah, I haven't heard that one. There have been a number of other things, the vaccine causes you to become so magnetized, or, there are chips, or, the poison thing. I think it's unfortunate that for whatever reason, these things are being spread widely. There really is no evidence for any of those things. There really wouldn't even be a way for the vaccine to make a poison, because again, it's a very narrow thing that it's doing. It's coding for the spike protein on the coronavirus, and that's it. There's no other. It can't tell your cells to do anything else. It can't make any other products, only the spike protein on the SARS-CoV-2. I in terms of talking to people that are vaccine hesitant, I think it is important to listen to people, listen to their concerns, ask them where their sources of information are. And yes, I know there are medical professionals in various places saying that this isn't a good, that this isn't a good strategy. I'm not sure why they're saying. I mean, I will say, unfortunately, some are saying it because they're trying to sell you something else to use, their product or their combination of whatever that they recommend. So I think some of them have some financial incentive to do that. But, every person's got to make their own decision about whether or not they're willing to take the risks, or what's your risk of illness versus what's your risk of side effects from the vaccine. And, I hope I made the point previously that the risk of dying from COVID in this country right now far outweighs any risk from the vaccine. But every person undergoing any kind of medical procedure has to make that decision for themselves. But I would encourage people to look at who's around them. Again, like you said, Jennifer, there are a lot of people who can't get vaccinated or whose vaccines don't work that well. So older people or people that have problems with their immune system, they may get vaccinated, but it probably isn't working all that well. So the best thing you can do to protect them is to get vaccinated so that you don't get sick and spread it to them. So,
Yeah. Thank you. Thanks for that. The next chat, this is a great segue because it is exactly about, if I've already had COVID-19, do I still need to get the vaccine?
The short answer is yes. And let me explain that a little bit. It is true that when you have COVID naturally, your body will make antibodies against that virus. The problem is we don't exactly know how long those antibodies last or how effective those antibodies are. And so we know, and we've seen in studies, that people that have already had COVID that get vaccinated, actually their antibody levels go way up, and so they have longer amounts of protection. The other kind of interesting thing we've been seeing in some cases is that people who've had COVID that develop symptoms of long COVID, which I'm sure you've heard of, they feel fatigued or maybe have shortness of breath or can't, just don't have the energy they had before. There's a lot of different symptoms of long COVID, but some people that get vaccinated when they have long COVID, actually their long COVID gets better. So there's some theory that there may still be some virus around even after you've had natural infection, and that getting vaccinated on top of that helps you kick out the rest of that virus. We know that, it's safe to give the vaccine after having natural COVID, that there's no increased risk in any way. And it certainly has a potential to keep your immunity going for a longer period of time.
Right. And would it be a true leap of logic, I guess, that if you have to have a booster after the vaccine, it seems like you would need a boost anyway after having natural COVID?
Probably.
In the same way, right? Okay.
Because with a vaccine or with natural infection, over time, your antibodies start to fall with any kind of infection. So,
right.
Yeah.
Okay. Thank you. So, we've been talking about safety and side effects, and one that has come up a lot, and with, I can understand why people would be concerned that if they are planning to have children or are pregnant or are nursing, is it safe to get the vaccine, and should they do that?
Yeah, I know that was a concern, certainly at the beginning of the vaccine trials, because there weren't a lot of pregnant women included in the original vaccine trial because, they didn't want to take the risk of a new vaccine in pregnant women. But as time, there were some women in that study that didn't know they were pregnant in the very original vaccine trials, and no problems with their babies at all. And since we've rolled out the vaccine to so many millions of people, there are thousands of pregnant women that have received the vaccine now. And many of them have been followed through this V-Safe reporting system. And studies have been showing that there are no increased risks of miscarriage, no birth defects in the baby. So we're not seeing any increased risk to the pregnant woman or the baby. And the other thing is that this mRNA platform has actually been used, like I mentioned before, in pregnant women for Zika virus and Ebola virus, and there's no increased incidence of side effect to the baby in those trials either. And so the American College of Obstetricians and Gynecologists and the CDC are now actually actively recommending that pregnant women get vaccinated for a couple of reasons. First of all, because pregnant women do have a higher risk of being hospitalized or ending up on a breathing machine if they get COVID. And the second reason is to protect the baby, because the antibodies that the mother makes actually gets passed on to the baby. So it's one of the best ways that you can actually protect your baby is by getting vaccinated, allowing your baby to get the antibodies from you, because they obviously can't get a vaccine.
Right. Thank you. I would point out, Mark had put something really helpful in there, a link with the CDC that helps talk about how to talk to people with vaccine hesitancy using motivational interviewing, which I know is used a lot for many lifestyle changes. So thanks, Mark, for posting that. Just wanted everybody to take a look at the chat because you might be interested in taking that link. Next thing that we have prepared is to talk about children and teens. So you mentioned earlier about Pfizer being FDA approved for 16 and above, I believe, and then you're talking about as we run down and hope to get younger children. So can you talk a little bit, just go into a little bit more detail about children and teens in this?
Sure. So Pfizer is, like Jennifer said, FDA approved for 16 and above. There's an emergency use authorization for 12 to 16. And I expect that in the next, probably by the beginning, the end of this month, there will be an expansion of that emergency use authorization for kids 5 to 11, because the trials have been ongoing. The data is looking good so far. You know, again, I'm not on the FDA. I don't really see the data, but what I'm hearing is that things are looking good. The kids are tolerating the vaccine very well, and it's giving them good levels of antibodies. So I think we're going to be seeing an expansion for kids down to 5 years old with the Pfizer vaccine, at least. There are good data right now. Moderna and the Janssen or J&J vaccine is really only for 18 and above, but there is data that's showing, again, good antibody responses and not very many side effects in adolescents. So I expect that we'll see an expansion of that in the next month or two as well. Mm-hmm. The important thing to know is that, you know, it is true that kids don't tend to get as sick with COVID as adults do. You know, the older you get, the more risk you have of ending up in the hospital or dying, unfortunately. Unfortunately, though, with the Delta variant, we are seeing more kids getting infected and more kids ending up in the hospital. The death rate is still pretty low, but, you know, it's an unfortunate thing when a young person gets a severe illness like that.
Yeah, absolutely.
Well,
all
it's
right.
Unfortunate when it happens to anyone, but
yeah, absolutely. Yeah, but yeah, I get what you're saying. I mean, the children, you have a special, you know, especially hard to see. Let's pivot a little bit. You had talked earlier about the flu, and I know we've gotten questions around, you know, should we go ahead and get our flu shot? Are we seeing it come up this year in a different way than we did last year? And can we get the flu shot and the COVID shot at the same time?
Again, the short answer is yes. We are starting to see some flu. There have been some reported flu cases in Southern Oregon already. Not too many in the Tri-County Portland area that I heard of yet, but I think we are going to see a more robust flu season this year because people are out and about more, and I think there's maybe a little less mask wearing because of, you know, vaccination. But I think it's particularly important to get your flu vaccine this year because it's going to be hard to know because the symptoms are almost exactly the same with flu and COVID. The only one that's really different is the loss of smell and taste. That doesn't generally happen with the flu, but everything else, the muscle aches, fever, cough, you know, is the same with COVID and flu. So important to protect yourself against both of those. It's fine to get the vaccines at the same time. I've been doing some vaccination clinics and I'm giving a lot of people one on each side, you know, and you know, might as well save yourself a trip. There's really no increased evidence for side effects if you get them both at the same time. Most places are happy to give you both shots at once. I generally don't recommend the same arm, but some people like to get it in both of them in the same arm. But you know, it's okay to do both. Your body, as long as you're not sick with something else, your body's able to mount antibodies, even though it's two different viruses. And like on the slide, if you happen to be a member of KP, you can schedule with us, or you can go to any of these other pharmacies that are listed. And if you're not a KP member, I'm sure either your medical provider or these pharmacies can vaccinate you as well.
Yes, very widespread and available at this point. You know, you mentioned something, and I think I just a plug for all our care delivery partners. You know, one of the things when you've we're already dealing with COVID-19 at such high levels that we're seeing across the state, some hospitals being full or close to full and struggling to take care of COVID-19. So being able to keep yourself out of the hospital for the flu can only help, you know, just the entire medical system to support people that do truly get sick more effectively. So something to consider in that regard as well.
Very good point.
Yeah.
We want to keep all of you out of the hospital.
Yeah, exactly.
Whatever.
Yeah. Well, that is the end of our prepared questions. So I think I will pass it to Mark, who might have a couple of words for us. And then if we have time, we can open it up for any additional Q&A. I think I have addressed all of the questions that came through the chat.
Super. Thank you both so much, Dr. Antoniskis, Jennifer. This is great. I wanted to address two things before we open it up for general question and answer. The first is, while I would like to believe everyone is here because of your general concern with public health and wanting to be a more informed decision maker about your own medical choices and help inform others, I'm sure, at least for some of our audience, this is coming up very intensively in your workplaces, in your unions, because of vaccine mandates that are coming fast and furious, whether from state and local authorities, federal measures, whether it be the pending OSHA emergency temporary standard, the Centers for Medicare and Medicaid Services, and beyond. So I just put in the chat a link to a fairly well-researched document that gives you, for anybody who's interested and who hasn't already briefed themselves on it, about the sort of legal precedents for these vaccine mandates. We've had a lot of conversations that I've been a part of with union members around the state, really wanting to know why the union can't fight these. What should we be doing about these mandates? So for anybody who's interested in answering those questions with some authoritative legal information, there you go. The other thing I wanted to flag before we get into questions from the audience is I just wanted to also mention that we've been talking with lots of unions at the Labor Center around the state and around the country, and we've seen that increasingly employers are taking vaccine mandates as the sole strategy for dealing with COVID-19 in the workplace. And I wanted to just make sure everyone realizes as your bargaining impacts over vaccine mandates, that you're also making sure that any impact bargaining you're doing addresses all of the safety and mitigation measures that we need to be maintaining, whether it's PPE, adequate ventilation, masking in the workplace, changing workplace access, in hospitals, perhaps limiting access for visitation, staggered schedules, all of the same measures that we needed before there were vaccines, we still need because of the infectiousness of all of these variants. So when you're impact bargaining, please make sure that you are not missing a chance to ensure that we've got these safety measures in place, and we'll have other resources for you as we go. But I want to open the floor for anybody who has any questions for Dr. Antoniskis or any comments that you'd like to make. You can feel free to raise your hand using the raise hand function, and we'll give you a call, or you can drop your question in the chat and we'll also read it out and get it answered for you. And if nobody's got any questions, we'll wrap up a little early, but I want to make sure to share the floor. This is the moment in the presentation where I tell people that I'm a Quaker. I'm used to sitting in silence for long periods. So we got plenty of time for you.
Yeah, so here's a question for Dr. Antoniskis. Can a person get the booster, a Moderna booster, if they had Pfizer, or vice versa? So can they switch vaccines?
That's a good question. And I know there are many strategies around the world. I mean, there are some countries that are intentionally boosting with a different vaccine. For example, if you got J&J, they boost with Pfizer or Moderna, and vice versa. In this country, we haven't adopted that strategy yet because there's just not a lot of data out there to make that recommendation. So right now, the recommendation, and because we have plenty of vaccine supply, is going to be to get the booster of the same thing that you got the first time around, just because we don't really have we don't have a lot of science to say that we should be switching. Well, could that happen in the future? Yeah, maybe. I mean, it may be that a year from now we'll have a different strategy, or even 6 months from now, depending on things that we learn about this.
Yeah, and I think there's another kind of revisit around why there are so many people in the medical community taking a stand against the vaccine. Why not trust the science, and what is their thinking? And I don't know if you have any comments on that. I think it'd be, again, conjecture. I think there's a lot of really poor information out there, and I think just from a layman's standpoint, not every physician is an infectious disease doctor, or not everybody that works in a medical environment is a medical, infectious disease doctor. And so, if you find bad information, you may be acting on bad information.
Yeah. And I think some of it actually is, I'm not sure there's that many people in the medical community, but they're very vocal, the ones that are opposed, and they get their message out there. I think when you look across, I'll say start with physician groups, you'll see that in almost all physicians groups, there's a very high vaccination rate, well upwards of 90%. And I think that, and I will agree that it's been very confusing, and the rollout has been very confusing, and the science changes, and the recommendations change, and I think people tend to have a hard time keeping up with that. And when things change, then it makes you think, well, what's the deal? Weren't they right the first time? Or
Right.
What's going on? And so I think you tend to lose trust there. But people that can really kind of look into the science and trust the science do. And I think it's unfortunate that in other groups there's maybe not as much I don't want to say understanding, but maybe not as much time spent actually looking into the data to look at it and see what you can get out of it. And so I think it is what it is, and it rolled out the way it did. And unfortunately, we didn't really have such a unified message in this country as there were in other countries. So, and it became politicized in a way that really hasn't ever happened with any other vaccine. And so I think that is only contributing,
Right.
Oh.
I think I'm sorry, go ahead, Mark.
Yeah, I just wanted to add one thing, Jennifer. I'm not a frontline healthcare worker, but I work with many. And I will say one thing that I've heard several people report among the, particularly frontline nurses that I work with, is a bit of, it's some combination of sort of battle fatigue and PTSD. Like we spent most of our year last year working on the front lines with inadequate PPE, with inadequate staffing, in the heart of the surges that we went through, and feeling a bit like, well, either, I got COVID and I recovered, or, just a little bit like, well, I've been through the ringer already. Like, so what could happen to me? And, and that's not a informed, like scientific review, reflection, but that I met several healthcare professionals who have kind of felt a little like that and sort of not been in a rush to get their vaccination as a result. But I will say, in that sense, also, I've seen many comply with the vaccine in the end of the day because they understand like this is well within the legal rights of their employer, and it ultimately does keep the community safer.
Yeah. Yeah. I mean, as Dr. Antoniskis said, it's your personal, you have to make your personal choice. And, our goal is to provide sound medical evidence for people to make that choice, hopefully in a clear, kind of non-distracted way, so that you don't have to dig through and find, what is it? Because you're right, even though, we got many iterations of the information, but what was interesting from my perspective, and Dr. Antoniskis, you can say more effectively than I do, is that even though I kept getting kind of, oh, now it's this, now it's this, it wasn't wildly different, right? It was kind of just getting it more and more dialed in, but it felt like things changed and changed and changed many times.
Right. And they did, but that's part of being in the midst of a fast moving epidemic. And that's the way science works, right? You try something, you learn something, you experiment on it, it changes. So it's not outside the realm of what happens in science all the time. But I think the speed with which it happens was kind of disorienting to a lot of people.
Yeah.
And it is hard to keep up with. But, we're learning things all the time in all sorts of medical, we don't really practice medicine now the way we did 100 years ago, right? So it's just, things are going to change. But,
and I think many of us hadn't had the front row seat that we've had here. Like
exactly.
Even with the CDC or the FDA or those kind of processes. I mean, I learned a lot about that because, some of the natural inclinations, sometimes think, why is it taking so long? Or why is it this? Or why is it that? And as you learn, oh, that is the way the process is set up. This is proceeding as expected, it's just a new, for me at least, it was new exposure to things that have been there all along or working all along. So
right. There is another question. I think it was sent to me, but probably should have gone to somebody like Dr. Antoniskis. It says, do you expect to see more breakthrough cases over time in people that are vaccinated?
Let me just back up and say what a breakthrough case is. So I think that's a great question. And so a breakthrough case is when someone is diagnosed with COVID after they've had a full vaccine series. So right now that'd be 1 shot of J&J or 2 shots of Moderna or Pfizer. And then if they get infected with COVID, we call that a breakthrough case. Do I expect to see that? Yes, because that is going to happen. No vaccine is 100%, and people are going to probably get infected. What's reassuring, though, is that people that have breakthrough cases are so far and away much less likely to end up in the hospital. So again, 10 times bigger chance of ending up in the hospital, 11 times larger chance of dying if you are not vaccinated. So you may get a breakthrough case, but the chance of you getting severely ill from that case is minuscule. And what's interesting is that we had some concern that people with breakthrough infections could transmit the virus. But now what we're starting to see with some new data is that probably even if you get it, it's much less likely for you to give it to somebody else, which is good news, right? So yeah, I think we'll start seeing more and more just because more and more people are getting vaccinated, and a certain percentage of them, 5% or so, probably will still get infected. But again, they're going to be protected from the most serious consequences of getting COVID if you get vaccinated.
Okay. Well, thank you everyone for your time. We are at 6:30, but wanted to just say we really appreciate your joining us and your engagement, great questions and great information shared. So thank you very much. And as Mark mentioned, he will be posting the recording so that if you want to revisit some of it or have share it with others, please feel free to do so.
Thank you very much for your attention and your great questions.
Thank you, and
Wash
be
your
well.
hands.
Wear
Get
your
a flu
mask.
shot. Get a COVID.
Before everyone goes, I just want to say this is the first in our seminar series, our wellness webinar series that we're doing with the Labor Management Partnership. So stay tuned for more great sessions, not about COVID, but about other really important topics. Thank you all for being here. And again, thank you, Jamie, Jennifer, Dr. Antoniskis, for being with us. And stay safe out there, and we'll see you soon.
Thank you.
Thank you. Thank you.
Bye-bye.